Edaravone, also known as Radicava Solution, Intravenous Piggyback, is used to treat a certain type of nerve disease called amyotrophic lateral sclerosis, ALS, also commonly called Lou Gehrig's disease. It helps to slow down the worsening of this disease. However, it is not a cure for ALS, and it does not reverse nerve damage or muscle weakness. It is given as an infusion into a vein, usually over a 60-minute period, once every 24 hours for 14 days, followed by a 14-day drug-free period. This cycle is then repeated. It is important to take this medication exactly as prescribed by the doctor to get the most benefit from it. Before starting the treatment with Radicava Solution, Intravenous Piggyback, it's important to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is administered through a vein, as directed by your doctor, usually over a period of 1 hour. For the first treatment cycle, Radicava is typically given once daily for 14 days, followed by a 14-day break. After that, each treatment cycle usually involves Radicava being given once daily for 10 days out of a 14-day period, followed by a 14-day break. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If you notice either, do not use the liquid. It's important to use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day and mark the days on the calendar when you need to receive this medication. Some possible side effects of Radicava Solution, Intravenous Piggyback include bruising, problems walking, or headache. If any of these effects last or get worse, it's important to tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, it's important to contact your doctor or pharmacist. If you experience any side effects, it's important to talk to your doctor for medical advice. In the U.S., you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before starting Radicava Solution, Intravenous Piggyback, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that can cause allergic reactions. It's important to also disclose your medical history, especially if you have asthma. If you are planning to have surgery, let your doctor or dentist know about all the medications and herbal products you are using. If you are pregnant, Radicava Solution, Intravenous Piggyback should only be used if clearly needed, so be sure to discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is not known if it passes into breast milk. Always follow your doctor's recommendations for the best time to take this medication and the proper dosage for your specific condition. When taking Radicava Solution via Intravenous Piggyback, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure your safety and the effectiveness of the treatment. If someone has taken too much Radicava and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. While using Radicava Solution, Intravenous Piggyback, your doctor may require you to undergo lab and medical tests. It is important to attend all scheduled medical and lab appointments. Make sure to take each dose of Radicava Solution, Intravenous Piggyback as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine a new dosing schedule. When storing Radicava Solution, Intravenous Piggyback, it's important to keep it at room temperature and protect it from light. Make sure to store it in the overwrap package until you're ready to use it, and once the package is opened, use the medication within 24 hours. Be sure to check the product information for more details. And remember to keep all medications away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.